Hi, this is Dr. Ashish Taneja. I'm an orthopedics and joint replacement surgeon. In this video, I want to talk to you regarding knee arthritis and knee replacement. I want to give you a clear understanding of what is knee arthritis and when do we need knee replacement. So if you see these models, our knee goes through degenerative process and we grade the degeneration into 4 grades. In the beginning, it's like this. It's like a normal healthy knee with intact cartilage. If you see in this model, the cartilage which is white is intact. आपका जो cartilage की layer है वो पूरी normal है. It's intact. मतलब कि बिल्कुल it's a normal knee. As we go along, जैसे जैसे we age, this cartilage tends to wear. If you see, there will be patches of arthritis developing. This will be a grade 2. In elderlies around 50s and over, this cartilage tends to wear out completely, in which the patient will have a lot of pain, deformity, difficulty in walking. इस time पे you would consult one of us for solution to this problem. If this knee arthritis is causing you a lot of disability, meaning कि आपको अपने नॉर्मल रूटीन एक्टिविटीज़ में चलने फिरने में बहुत दिक्कत हो रही है, आप जितना करना चाहते हैं उतना नहीं कर पा रहे हैं बिकॉज ऑफ नी आर्थराइटिस, देन यू मे बी अ कैंडिडेट फॉर सर्जरी. एंड व्हाट इज नी रिप्लेसमेंट? नी रिप्लेसमेंट इज नॉट व्हाट वी थिंक अबाउट. नॉर्मली लोग सोचते हैं कि नी रिप्लेसमेंट में पूरा नींद निकाल के नया नींद लगा देंगे. ऐसा नहीं होता है. Knee replacement is simply a resurfacing of the bad layer of cartilage. What we do is we just remove the bad about 9 millimeters of cartilage layer. Like अगर आप देखेंगे इसमें, इस मॉडल में, इसमें से आप सिर्फ इसका bad cartilage की layer, जो कि बहुत ही मिनिमल about 9 millimeter मैक्सिमम की लेयर होती है, उसको शेव ऑफ करते हैं. नीचे टिबियल साइड पे भी करते हैं. मेक अ वेरी फाइन कट which takes off the 9 millimeter layer of bad cartilage, and then उसको हम replace कर देंगे in implant से. We'll put a tibial implant, we'll put a femur implant on top like this, और फिर इसको balance करने के लिए we have a insert. This will help us balance the ligaments on the side. So this is exactly what is done in knee replacement. Now the big question, when do I need a knee replacement? A simple answer is when your walking is limited and you need painkillers on regular basis, you would need a knee replacement. Or there are a lot of confusions amongst patients coming to me which is the best implant. Normally knee replacement has 2 or 3 types of implant only. One is a standard implant which is made of alloy of cobalt and chromium, like this one. This is used in almost 90% of the patients. Other materials are, one is a oxynium knee, which is finer material than this one. It is supposed to give us slightly longer survivorship. वो थोड़ा ज़्यादा survive करता है in terms of long lasting ability. And the third one is gold knee. So these are the 3 main types of knees which we use in our knee replacement surgeries. The last thing that people are worried about is success, how successful this operation will be. I would say if we select the patient correctly, if we do it at the right time, the success rate is as high as 95%. I personally try to remove all the possibilities of any complications by doing a formal investigations before surgery. We screen you for all the possible risks of complications and try to optimize them before we take you up for surgery. And if we follow this protocol, the risks are markedly reduced. So I would say should not be worried about this surgery and the complications. If you are really in pain and you are suffering because of pain, it's the right time to consult for knee replacement.
Book your surgery appointment on pristyncare.com. Pristyn Care.